So I first want to introduce myself. My name is Ali. I'm the compounding pharmacist and the chief executive officer of King's Pharmacy and Compounding Center. We have locations here in Fullerton at St. Jude, and we have a location in Newport Beach at the Hoag Health Center. Today we'll be presenting a lecture on the essentials of hormone replacement and sexual dysfunction. I'm speaking with Dr. Nicholas Thanos, who is at the Center for Women's Health. He's a board-certified OBGYN. Many of you know him. I've come to love him as a practitioner. I think he's a wonderful doctor, and we work very closely with him here in our Fullerton location. Just a few little things about who we are and who King's Pharmacy is. So King's Pharmacy and Compounding Center, currently we're the only chain pharmacy group in California that is accredited in compounding. And that PCAP seal of approval basically yields us as an accredited compounding pharmacy. Our pharmacists are trained specialists in bioidentical hormone replacement therapy. We talk on the daily with doctors like Dr. Nick, and we review your labs and work closely to basically find and utilize the best therapy that works for you. In each of our locations, the personalities of our staff set a really peaceful and positive environment for our patients. Now, it does help as well that the doctors who we work with really help to elaborate and explain to these patients what's going on so that we don't have to re-educate. It makes it really nice when we have a patient, for example, a patient of Dr. Nicholas Thanos that comes in who has gone to great depth of explaining the situation, symptoms, objectives, and whatnot. And it's patients come in well-informed and ready to start their therapies. One of the biggest issues that we have currently is insurance companies, as we all know. Getting things covered is a day-to-day problem that we incur. We do our very best to utilize insurance. I mean, if you're paying $500, $600, $700, $800 a month for insurance, why not utilize it? It is a very common practice by a lot of compounding pharmacies to say it's not covered. Well, it's not that it's not covered. There's really a few insurance companies that don't cover compounds. It's a pretty lengthy and tedious process to get medications that are compounded covered. In a situation where a medication is not covered, what we will do is we will find the best and fair cash price that kind of meets your needs. Our ingredients for our compounded products, a majority of them, the big guys, progesterone, estrogen, testosterone, are domestic. We don't buy from India, we don't buy from China. Not that there's anything wrong, but those facilities here in the United States have gone under certain scrutiny that you don't typically see in some of those international laboratories. Our checks and balances is through the roof. I mean, we go through 2 different pharmacists, have to check each formulation, and the final compounded preparation is examined by 2 pharmacists and at least 2 other technicians. That's just on making it. As far as filling it, you got another 2 to 3 checks. So when you're all in, you're about 10 different checks along the way from a raw powder to a final finished product. We carry a wide array of items, vitamins and whatnot, and our pharmacists have a deep knowledge base on a lot of these subjects to help patients improve their outcome. Now, one thing that I want to touch upon is this PCAP Accredited Compounding Pharmacy. If you've listened and paid attention to the news in the last 6 to 7 months, you've probably seen what's gone on with compounding, especially with the New England Compounding Center Pharmacy in Connecticut, and how they had contamination in certain products, and patients got products that were, that were not sterile, and as a result, there were a lot of negative outcomes, including many deaths. What PCAB is essentially an accreditation body that goes out, it's voluntary, to individual pharmacies that seek accreditation. They don't just go out and do it on their own. You have to actually call them and say, listen, I want to get this PCAP seal. Why don't you come in? This is how I do everything, and I want that PCAP accreditation. In the state of California, just to give you an idea, there are only 21 pharmacies that are accredited by PCAP. Now, in the entire United States, to give you just kind of a perspective, there's almost 7,000 pharmacies that compound. But out of those 7,000 that compound, there's about 180 that are actually accredited in compounding. And we have 21 in this state, 4 in Orange County. 2 of them are ours. There's one called California Pharmacy in Newport Beach and McGuff in Santa Ana. That's it in Orange County. In surrounding cities, you might find 1. LA, you'll find a couple more, San Diego, and up north. So it's really important to find a pharmacy that is accredited. And why is this so important? Well, compounding medications are complicated. It's not like just filling a tablet and putting it into a vial and putting a label on and giving out to the patient. There's a lot of differences in quality, sterility, and potency. And the biggest thing is potency. And what does that mean? Well, if a drug is supposed to be 100 milligrams, and whoever makes it for you, it comes up to 75. Well, you don't know as a patient. You're going to come in, you're going to expect that you're getting 100 milligrams of drug. Unfortunately, that may not be the case. I always use the analogy of, if you think of lasagna, you can go to 10 different restaurants and order lasagna and it tastes different in every single place. With compounding pharmacy, because these formulations are done by hand and they're made by individuals, there is variation in the final product. So the bottom line is, because there is variation, that could yield a different potential outcome for each individual patient. So if a doctor prescribes something and 6 weeks later he tells the patient to come back and say, well, I want to see your levels, and the levels don't make sense, well, is it because the drug wasn't made properly, or is it because it wasn't enough drug that was prescribed in the first place? So it makes the doctor's life a lot easier when he's prescribing medication and he knows that what he's prescribing is what he's getting. That's why PCAP is so important. It really ultimately means quality assurance. And as I said, it's not mandatory. We get audited by them. If we're ever in violation, they can strip it or put a nice little fine on us. And it is a lengthy process. It is a full day inspection where they pretty much go through every single thing that we do. These are, I'm all about learning and educating. I'm actually doing my fellowship in anti-aging medicine right now, and I think it's so important for myself and everyone else out there to constantly educate themselves on hormone therapy, sexual dysfunction, because these are not topics that typically are discussed outside of a doctor's office. You might be watching, Dr. Oz or, just Suzanne Somers or even Oprah, and you're going to hear about hormones and how they affect women and how they affect the husbands and so forth. So I think it's really important to read up and become aware so that you know what you're getting yourself into. Because it's very difficult to tell someone that they have hormonal dysfunction if they're not at that point there to start. Suzanne Somers, I like a lot of what she does. I think she's done a great thing for hormone therapy. I think she's really opened up the discussion. I don't agree with everything she says, but for the most part, I think she's taking us in the right path. I think when you have doctors like Dr. Thanos and some of the doctors that I've worked here in Fullerton and Newport Beach going that same direction, it really helps utilize what we have. And what we do in our practice and in Dr. Nick's practice is replacement. We replace hormones, and that's where we get the best benefit. We don't substitute. If you come to me and you have an ailment, I'm not going to give you an antidepressant to help deal with that effect. I'm going to try to figure out what the cause of the situation is. So I'm going to go ahead at this point and pass the mic over to Dr. Nick. I know you're going to enjoy listening to him because I always do. So I'm going to put his screen up here and I'm going to pass the mic on to him.